Hello and welcome. I'm Carolyn Gartner, therapist and thanatologist. And today I'm super excited. I'm here with Stephanie Omens, and this is actually a little bit new. We're talking to a drama therapist who works with kids. I don't work with kids, so I was really excited to read her book. As you can see, I wrote in it, and it was amazing. I love this book. It was so amazing. Really important work you're doing, and something I don't really know as much about. Like I said, I don't really work with children. I work, with adults, and I cover really varying topics within adults. And I loved your book. And oh, and also look how pretty it is. Beautiful. Yeah, they did a really, really nice job with your.
Thank you. Yeah, thank you.
So anyway, welcome, Stephanie, and I'm going to read your bio. Is that okay?
Thank you. Yeah, nice to be here. Thank you, Carol. Yeah.
Okay, Stephanie Omens is a licensed creative arts therapist, mental health counselor, registered drama therapist, board certified, and certified child life specialist in private practice in New York and New Jersey. She's an adjunct instructor at NYU and Lesley University. And for further resources, contact her at her website is No White Lies, with no spaces, nowhitelies.com. And we're going to talk about that also in a little bit too. So welcome. As you can see, I'm very excited.
Thank you. It's super nice of you, Caroline. I'm happy to be here and talk about the work.
Yeah, so I thought maybe you could start with defining maybe a little bit about drama therapy or any aspect of it that you could just kind of help define for people, kind of what that means and what that looks like.
Sure. So the book is kind of got a longer name, Drama Therapy and the Bereaved Child. And it's telling the truth to children during difficult times. So it's a book that discusses how, as a creative arts therapist, I tell stories. And that's sort of my main point of view is what's the story? What's the story? In terms of drama therapy, which is what you asked, what's a drama therapist? Did I get it? Did I remember?
Yeah.
Yeah. So drama therapy is a form of psychotherapy, a psychotherapeutic discipline that combines counseling skills, individual skills, group counseling, psychopathology, all the same things that one would learn from a social worker or licensed professional counselor, clinical mental health specialist. However, the hybrid part is having the experience as a creative artist in the creative arts. The creative arts therapies are drama therapy, dance and movement therapy, music therapy, art therapy. And they are all, the foundation is the premise that the creative arts or art in and of itself is healing. And if you combine then those healing aspects for drama, right? Story, metaphor, spontaneity, creativity, and psychotherapy, there you find what this sort of hybrid, what I am, a drama therapist. And that is my theoretical orientation.
Yeah, it's amazing how, and maybe we'll talk a little bit about some of the interventions. In the book, will you kind of maybe tell us a little bit about the setting that you were in, that you spend most of the book focused?
Yeah, sure. So for about 20 years, I worked in a pediatric hospital prior to being full-time in private practice, which is what I do now. And I was a part of a particular department in pediatrics called Child Life Creative Arts Therapy. And I'm also a certified child life specialist. And I worked, of course, in pediatrics with providing psychosocial support for children. Over the years, though, there became a need that I was aware of, I became aware of the needs of children in the hospital center when their parents were facing an end-of-life trajectory or an illness that was life-limiting. So those folks in adult oncology, in the intensive care unit, emergency room, hospice, palliative care, that those, right, that part of the hospital, right, children may be there on those floors and in those units. However, there was no one dedicated, there still is no one dedicated, and in many hospitals, this is true, specifically to meet the psychosocial therapeutic needs of those children that are part of the family, right? So I became known for, or was called upon to cross over to adult units and work in coordination with the doctors, nurses, and the families and patient, not in that order, to meet the needs of the child.
And I'm just gonna jump in. So I work with adults, and I have a number of people in their 30s who come to me, and they often, most of them lost a parent, though sometimes we have siblings, and they talk about they didn't really get much support at all. And especially when, like, the littler one, the younger ones. And, I'm always like, oh, I hope it's changed. That was 20 years ago. Oh, I don't know if it has, I'm like, oh, so I see them, many years later as an adult. Right. But yeah, where is the support for these kids? Like you said, they're not the dying child, they're the child of either the parent who's dying or sometimes a sibling, right? So they get lost, they get left in the shuffle. Yeah.
Right. And sibling work, so sibling grief and bereavement is happening in the pediatric hospital. And over those 2 decades, I worked with lots of children who were facing end of life trajectories and or active phases of their illness towards death and die, as well as the siblings. So, but the focus of this book is around using drama therapy with bereaved children in the adult area. Unfortunately, what you're raising is really true, and I'm not sure so much has changed. I can't speak nationally or internationally, but often those children are, I use the term lying, and truth telling to children during difficult times is in the title because parents don't know what to say. So when I call it the lie, and I do in my website, No White Lies, right? And I really do want to call that out. And I mean, there's no malintention to not tell the truth. People don't know what to say or how to say it. And often things get omitted, or the child's needs, therapeutic needs,